Well, we are here on site live at the AAD 2026 meeting in Denver, Colorado, and I'm here with Dr. Vinod Nambudiri, who's going to talk to us a little bit about some different topics here today. So Dr. Nambudiri, could you first just sort of describe a little bit about your background for those in our audience who may not know?
Sure. Thanks so much, Tim, for having me here. Pleasure to join the podcast. My name is Vinod Nambudiri. I am a medical dermatologist. I'm based out of Brigham and Women's Hospital in Boston. And my clinical work spans medical dermatology as well as the care of patients in oncodermatology or cutaneous oncology. Outside of my clinical work, I also spend a lot of time thinking about medical education, overseeing our residency program. For trainees in the Harvard Combined Dermatology residency system, and do some administrative work in our hospital related to clinician well-being and thinking about sort of some of the factors that are at play there.
Yeah, absolutely. Well, thank you for sharing that. And I wanted to talk to you a little bit today about the AAD clinical image collection, which is a topic that I know we've discussed a little bit before. So could you first go into a little bit about the impetus for developing this collection and what sort of gaps it was designed to fill?
Sure, absolutely. So the image collection is a several-year process in the making. The AAD has historically been a wonderful leader in the space of education in dermatology, often viewed as sort of the gold standard of educational materials and products and resources for the training of dermatologists, both kind of during their clinical training phase, but really lifelong beyond. They also do a lot of work related to patient education materials and such. But one of the gaps that was noted, not only in the AAD's scope of medical education, but really in many forms of resources that exist, particularly dermatology textbooks and other kind of reference materials for educating dermatologists about skin disease, is that there was a real lack of diversity of representation within the teaching materials, within these clinical images. And in particular, one of the things that was lacking was a spectrum of skin tones or skin colors that various clinical conditions were presented in, and in fact, some cases where skin tones or skin colors were overrepresented disproportionately that could lead to potential downstream consequences for dermatologists or other physicians having gaps in their knowledge about how diseases present in a variety of skin tones and skin colors. And so with that impetus of really wanting to meet a need for the dermatologists' membership, that was recognized by dermatologists themselves, the clinical image collection was stood up by the AAD in order to help address that gap.
Right, yeah. No, and I remember us talking about this a little bit last year as well. So I'd actually love to ask you, how has the collection sort of grown since its launch in 2025?
Yeah, we got things off the ground officially in January 2025 with sort of a soft launch, a little bit of buzz, and then by March of 2025 at the AAD in Orlando at that time, we had kind of our first official welcoming and launch event at that meeting, which was really fantastic. We have a work group of about 8 or 9 members that are involved. All of them are AAD members that are actively engaged in curating this collection. We're very fortunate to be partnering with Skin of Color Society, and they have representation in our work group as well, to have inputs from a variety of dermatologists who are passionate about this work. And since that time, we have grown tremendously. We started with a few dozen images in the collection, and as of February of this year, so just over a year after our launch, we have over 1,800 images in our collection and over 3,000 members who have accessed or created an account to access the AAD clinical image collection, and over 65,000 views of the images. So I think we've had tremendous growth in that 1 year. It's definitely been something that generated a fair amount of buzz within our specialty and was really celebrated by the leadership of the AAD, which I think has helped champion it to a variety of our members and has allowed it to grow through the contributions of individual AAD members themselves.
Yeah, no, absolutely. And I know that is a topic that we cover a lot on this podcast, is the kind of lack of representation within clinical research, in terms of clinical education. So, it's good to see that it's kind of grown and expanded in the past year. I wanted to ask you as well, what kind of images are included in the collection and how can we sort of use it?
Yeah, fantastic question. We really are wide open in terms of diseases, morphologies. We want this to be a representative collection, meaning everything is fair game. When an AAD member goes to submit a clinical photo, clinical image, they tag it to a specific diagnosis, and those diagnoses represent the full spectrum of dermatology. So we have pictures of inflammatory diseases like atopic dermatitis, psoriasis, hidradenitis, alopecia, the spectrum of inflammatory disease. We have pictures of skin malignancies, including melanomas, squamous cell carcinoma, basal cell carcinoma, cutaneous lymphomas. We have pictures that represent chronic conditions in various states. So pre-treatment or post-treatment, we have images of infectious diseases of the skin. And so I'd say it really, truly represents a wide spectrum of disease and continues to grow. So those are a handful of the categories of diagnosis that are there. And we also have every image in the collection tagged not only by its diagnosis, but by its skin tone that it represents, essentially light, medium, or dark. And that allows for a user to search through for individual images based on those tagged diagnoses or skin tone, or even the relative age of the patient. Is this a pediatric patient? Is this an adult patient? And so we really hope to make this a usable, user-friendly platform or site for our members to be able to take advantage of.
Okay, that's great. And who can use the collection?
It's open to any and all AAD members, and we hope that they are able to take those images and use them to educate really quite broadly across the scope of medicine and medical education, whether that's their own trainees in the field of dermatology, whether it's medical students who are going into any different discipline, whether it is peers and colleagues in other specialties of medicine, maybe an emergency room physician who is diagnosing a rash, maybe an allergist that is diagnosing a drug reaction in the skin. Any of these groups of individuals could really stand to benefit from additional clinical imaging that's been vetted and curated by dermatologists to represent disease across a spectrum of skin tones. So that's really the use case. I know of colleagues that have used images from the collection in talks at the AAD.
Oh, really?
And that's a great kind of full circle moment here of something that like the membership identified that they needed, we created, pushed out to them, and then has now been used to like educate more members. And so I think that's sort of like a really nice full circle moment, and we're anticipating more of those as time comes.
Okay, that's great, and great to hear that it's being used, yeah. I was going to ask you as well, what is your hope for expansion of the collection?
Yeah, well, some really exciting news on that front. We are, as I've mentioned, dependent upon members to really engage with us and donate images or upload images to the collection. And we've had really great uptake, hundreds of members that have thus far contributed.
Wow.
But we're very excited that we can announce, or that we've been the recipient of a few large donations, each well over 1,000 images, that will allow us over the course of the next year, as we vet and process and digitize and upload all of these, to have our goal over 10,000 of these uploaded into the collection as soon as we're able to. So I think that really speaks to this exponential growth that we're able to achieve due to the support of our membership.
That's excellent. Okay,
Yeah.
well, great to hear about the future of it, yeah. Okay, now I kind of want to pivot here on
Sure.
topic. I want to ask you a little bit about what you presented at the SOCS symposium that recently happened, because I know you spoke about AI,
Yeah.
which is a topic that I know gets talked about a lot in medicine and also specifically in dermatology. and you spoke on a panel, I believe, on physician care and wellness. So could you share some of your biggest takeaways from those talks?
Sure. Maybe let's start with the AI
Yeah,
topic. I agree, AI is a topic that gets a lot of interest and excitement from several of us in the healthcare space. There's also a bit of anxiety, fear, anticipatory angst around like what is this and how is it changing the face of medicine. And I think
right.
both of those are completely valid emotions to have about AI. I think when you hear AI and terms get thrown around like ChatGPT or Gemini or Copilot, these are all a variety of platforms that have become very easy to access. And then there's sort of a second order layer of AI being integrated into our clinical workflows and processes in medicine in general, but in dermatology in particular. And so during my talk, I tried to highlight some of the ways that implementing or utilizing AI in clinical practice can have a positive impact on your day-to-day work as a dermatologist. And so some of the examples that I cited, it was really wonderful to hear that folks have actually already started adopting and embracing some of these in what they're doing. So for example, the use of AI-based scribe technologies
Right.
to assist in documentation. Documentation burden, if you will, is one of the major challenges that can impact physician well-being. We love to take care of patients, but then sometimes writing a note afterwards can be quite burdensome, especially if you're seeing a high volume of patients day in and day out. And so using technologies that can help us make that work easier is something that AI has already demonstrated the potential to do, and in doing so have a positive impact on clinician well-being. And so it's sort of a win-win type situation as these technologies get better to be able to help in clinical practice. And so that's one example. A second example that's being piloted, and some folks mentioned they have experience with this as well, is in helping to address patient questions or messages that come into like your health record inbox or in basket. Those requests, again, are quite important. We want to be there for our patients, want to take good care of them, but sometimes they too can either become quite voluminous or burdensome depending on the number that are coming in at once or what you're being asked to do, or the back and forth that can sometimes be unclear. And so many groups have experimented with AI helping draft responses. It's not an automatic reply. It's really a parsing of the information in that message and then crafting a response. You may use an email service that already does kind of this for you, so it's a very analogous type of approach. And so I think that's a second example of how incorporating AI technologies into the clinical work that we're doing may be quite beneficial to allow us to take some of the things off our plate, so to speak, that are otherwise diverting our energy and diverting our headspace, if you will, that can now be reapportioned to actually taking clinical care of patients and doing the other things that we love to do all the time. So that's sort of the AI bucket,
Right.
of what I spoke about. And then shifting gears a little bit to the panel, it was a wonderful experience to be up there with several peers and colleagues, and all of us kind of coming at strategies for wellness, well-being, mindfulness that we all bring different perspectives to. So I really appreciated that. For me, one of the things that we were focusing on in the conversation that I thought was really important was kind of identifying the things that allow you to sustain, that allow you to keep having energy for doing what you do. And there were a couple of things that I shared that have been really helpful for me as I've developed my professional career. One of them was making sure that humor plays a role in everything that we approach. I mean, not everything. You don't want to always be kind of not taking things seriously, but you have to sort of like stop and appreciate sort of the humor in our day-to-day lives. There's so much chaos going around in the world all the time. There's always something. So if you don't kind of pause and appreciate like the levity of things, and when you have the opportunity to take those in, I think then you tend to get lost. So people say laughter is the best medicine. I think that's a good like kind of bumper sticker type thing to try to keep in mind. It may not always work for everything, but I think if you don't have any kind of humor or ability to appreciate, enjoy what's going on around you, you're gonna suffer. So that's that was my kind of first Pearl takeaway. The other one was a little bit more of like a practical thing. You have to realize there are limitations to what any one of us can know at any given time, and being comfortable with saying, I don't know, or I need help with something is such a empowering feeling to be able to get to. There's a lot of pressure for all of us to say like, oh, I know the answer, or let me get this right, and we all want to do a good job. But part of doing a good job is also recognizing your own boundaries. And I think for me, when I had that revelation or really embraced that concept, that was very powerful for me to say like, look, I am doing my best here. I don't know exactly what's going on for you, but that doesn't mean I'm leaving you hanging. We're going to figure this out together. It might take some time. And I'm unfortunately able to tell you exactly what the answer is right now, but I'm not leaving you hanging. We're going to try something, or I'm going to ask a friend, or we have a plan, we have a next step. And I think appreciating that helped me feel good about the role that I was playing. I wasn't leaving someone in a lurch because I didn't have the answer. I was there to help kind of approach finding an answer together. And so when you think about something like that way, it makes you feel much more useful or much more impactful in what it is that you're doing. When you do know the answer, great, awesome, like lean into that and embrace it, and that makes you feel good too. But then don't weigh yourself down by that. Oh, I just don't know, and kind of not let that gnaw at you, because that'll sort of undermine that well-being aspect of everything that we talked about. So those were two of the kind of big picture takeaways. There were lots of really great pearls from the other folks on the panel that I took away from too. The importance of sort of habit formation and routine formation that works well for a lot of people. The importance of gratitude and the way in which that's administered, the importance of sort of having a really great team of folks that you work with and collaborate with, and if you're running your own practice, that are sort of like on your payroll, that kind of a thing. So really great insights. I think my biggest takeaway from it was that it's a very individualized approach to this challenge or problem, or this good problem that we have, which is, we get to be physicians, but then that comes with its own associated challenges for us as individuals, and we need to say that and name it and recognize it, but then also appreciate at the individual level, there's all sorts of different things that we can be doing to build that kind of personal resilience and accentuate our fulfillment in the day-to-day work that we're doing.
That's great. Okay, well, thank you for sharing that. And I feel like that's a good point to end on. So I appreciate your time, Dr. Nambudiri. Thanks so much for taking the time to join us here at the Skin of Color Savvy podcast. And to our listeners, make sure you check out the rest of the podcasts like these on the Skin of Color Savvy webpage for HCPLive. And until next time, thank you for listening.